You got that?
This is lower triad.
Lower triad.
So they all
very nice. Beautiful upper.
All right, Dr. Emilio here with the patient. Cannot see him, but we're going to do the upper denture, lower flex partial, how to take the impression, how to take the bite block from bite, so we can show you a little bit more. All right.
We also trimmed the patient's left side a little bit.
Nice. Nice. Yeah.
Very good. We'll try the top one in now.
So we concentrate the other patient's left side bite, and then we see the
Okay, close.
same level.
See? Because I can put my impression material right in there. You see the grooves? It's gonna tell you exactly where the upper arch and lower arch are gonna be in reference to one another, because now we have those grooves. That's gonna help too with the impression, okay? If he opens, he bites down all the way. Close, close. Look at that. I think we're ready for a nice bite impression. The only other thing that we need to do is one thing that I was gonna talk to you about today, is sometimes if you're having a hard time, difficult time, go ahead and look at that upper frenum right there. You see that right there? That's a great reference point for his midline, okay? So right now,
Hold on. Okay.
see that? That's a great reference point for the midline right there.
Frenum.
See that? Yep, the frenum.
Okay. So we're
Okay.
gonna set the teeth.
Yes, so
All
I
right.
set the teeth. Okay, that's one way to do it.
What
The
about the nose compared to?
So the nose is always, mostly, in most cases, the nose is going to shift towards one direction, and the chin will usually turn in another direction. So one of the things that we talked about, and actually we're adding to this video, is that you can take a full picture of your patient on your phone or your iPad, and you can add a line right down the middle of the face, and that's a good reference point as
So
well
now-
to make sure that your midline is correct, to confirm the midline is correct. So right now,
So you think you can?
yep, we'll make the midline right now.
Right?
But you can see that's a good reference point right there.
Gracias.
See, there we go. Just a little bit of this one.
That was is one of the reasons. Usually we made the bite black. If we don't know, we made the higher. So once doctor took the bite, and they're always off. So when we get the bite, whether they take the good bite or bad bite, from the bite block, we cannot get accurate occlusion. So the problem is whenever we set the teeth, and we have to reset the teeth. So bite block is extremely important actually. You know me, I'm a ceramist, right? But I noticed that bite block is the most important stage, which a lot of people doesn't understand.
So now I have grooves here, here, and I have grooves for the top, okay? That way when you take the impression, the lab knows for sure where they need to mount it. Point.
For denture midline.
That's a good reference point to give you a good idea of where he normally sits. Then you can actually take a picture if you wanted
Lower
to.
too.
The lower is fine. You always go based on the top. Most cases, the lower teeth are not always going to align perfectly. The lower dental midline is usually not going to align perfectly with the top in most cases. Okay, that's not as likely, but at least we have a good reference point. So what you can do at this point, if you really wanted to even perfect it even more at this point, once you have this line referenced by your frenum there, right? you can take a picture of your patient's face and then center a line on your phone or your iPad and see where that line falls in reference to what you marked. That'll help you too, okay? And then, so remember we had put those grooves in there. We had put those grooves in there, and now they're gonna come in handy, right? Okay, close. There we go,
Nice.
perfect. And then I like to keep the patient closed. Then I use their lip relax right there. And just put a little bit of pressure on there. That's pretty much hard. This is a fast set bite registration material. Okay? Open.
Oh,
Perfect,
hold
perfect,
on,
perfect.
hold on, one more time.
I can't, you're not gonna, got it? Okay.
Yep.
And then, see, watch this. See, that's a perfect registration. The way you confirm to see that all teeth are touching, you can see that underneath.
Mm-hmm.
And then, now is when these grooves, you're gonna see that in between here, you're gonna have this material with grooves, and that's gonna help your laboratory determine and make sure and confirm that the reference of the upper and lower arch are correct. And that's what you send to the lab, okay? If there's a change in the midline that you notice, after you mark it, you can remark it if you have to, or you can send a picture to the lab telling them where the midline is in reference to what you have marked. You can send that picture from your phone. Okay?
This patient's fine with this, but the other patient we see, sometimes they complain about the bulky. So then we can cut it before we set it.
Yeah.
So then I think much better idea, because whenever we got the bite block and then we set the teeth,
Correct.
and then we have a problem. I mean,
Right,
not problem. We don't know.
So
when we set up.
So I understand what you're saying.
Yes.
And what you're saying is,
Not this patient.
not this patient in particular, but you whenever before I take this impression,
Right.
the upper arch, I start with the upper arch.
Upper arch.
I need to make sure that the wax is not all the way out.
Right.
Right?
Make sure their lips is more comfortable.
Correct.
It's not like, okay, bite is good, whatever is good, but it's okay. But whenever we got the cases, we fight them. We just set the teeth, nice setting, whatever, right? And then we deliver it. Oh, it looks bulky.
So that is one thing, is that we
can trim it.
we do trim this prior to taking this impression.
Yeah.
That's important. And what I do is I'll use a long spatula. I warm it up, and I'll actually hold this in this direction, and I'll come around like.
That's why we did it before.
I just keep coming around from the front, and it drips onto my tray, the excess wax.
Right.
So I get what he's saying, and he's correct.
And probably we can see the side view. The doctor can see the side view with the patient, even though patient did not know. But instead of, hey, this is a bite block, we take the bite. Instead of that one, so we can explain, hey, I just want to make sure that your lips is not bulk out, not look like monkey. Right? So that was a good idea too.
One thing that
this is laboratory standpoint, I'm not
correct. From a dental standpoint, one of the biggest challenges right now that patients do not understand is that they feel that their denture is a little bulky in front.
Correct.
Okay, but they're forgetting that we did the most amazing favor to them. And that is that when we took their teeth out, we transplanted bone into that area to give them the much as bone as possible.
Right.
It is the best problem to have, because then when it's time for implants, it's not going to be a problem, And so at first the patients might say, I feel it's too bulky. And I said, well,
if they don't listen, what are you going to do?
Well, remember that the goal for them eventually is to get them implants.
Right.
And that's a good problem to have.
Yeah.
And they do understand that afterwards. It's better to have too much bone than to not have enough bone. Right? So that's the best thing that you can do. And I also remind them that we are giving them a beautiful denture to get them from this phase of not having teeth to the phase of when they're going to have implants. And once they understand that that's the most important thing, And usually when I send them, if I send them to my oral surgeon will explain to them, wow, you have a lot of bone, this is great, right? So that's more important in the beginning. We do the best possible to give them the most aesthetic, most functional denture in the time being. And that's very important.
Okay, cool.
Okay, this is a just a quick wax just to see where his profile is, looking at the incisal edge. And this is something that Luke made for me, just to give us an idea of where he is in his bite. So, try that in. Okay, relax. Okay, relax right there. It's actually looking pretty good if he relaxes his lip. In men, you want to see 1 to 2 millimeters of the front teeth. If you're not seeing that, then it can make you look a lot older than what you really are, okay? Because as you age, you tend to wear some of your teeth. So you want to see about 2 or 3 millimeters. With ladies, well, actually 1 to 2 for men. Ladies like to see a little bit more, sometimes 2 to 3. So that's something that can really, really give you a youthful looking smile. So the way that the length on these is a nice setup. It's a good example to be able to show you where these teeth should be set, okay? Got it, so we're gonna try in, the lower one's gonna be a lower flexible denture for the time being, because what he'd like to do is he would like to get some crowns on his lower teeth. He'd like to get some crowns on his lower teeth, and then we'll match the color a little bit. Right now he's currently bleaching. He's currently bleaching his teeth a little bit. You can see that they're not that far off. This right here, that's a lot of bone. So we're gonna show you a picture, and we're gonna post a picture so you guys can see all the teeth and his situation here that he had on top. Look at the extent of the beautiful bone that he has. Look at that. That's gorgeous for his implant case afterwards. And I mean, when we place implants there, I mean, that's nice. It's really nice. And even though it looks like you have bone on the outside, the most important part is on the biting surface. That level of bone is really nice. So his case is set up. You can see that. Nice and set up now, okay? We extracted all of the teeth, but most importantly, the most important thing is whenever you extract teeth nowadays, you have to graft. So you have to put bone graft. You have to put bone particles wherever the roots were, so that this patient is going to be ready for implants in just a couple months. You can see that, how beautiful he's healing and the amount of bone that he has and we left behind. On the lower teeth, he had a very serious periodontal disease on the lower teeth, and we were able to clean up all of that tissue and extract the teeth. Well, this is how he was beforehand. You can see the extent of the periodontal disease, broken teeth, decay. And if we look at his smile now, open. If you look at how the teeth were uneven and flat, we actually got this up to the bite. We fixed his, we leveled off his bite. If you look, open. See how we leveled these teeth off so we can use them. Later on, he might put some nice crowns here, some nice porcelain crowns. But look at the difference, okay? All these teeth are definitely not level. Neither are these. In his case, what we decided was to keep his natural dentition, his natural teeth, because the lower teeth, if you remove these teeth, it's very, very challenging to keep a denture down there without implants. Nowadays, these lower dentures, they kind of float, kind of like a sailboat in the ocean, and they're very challenging to keep down there without implants nowadays. So in effort for financial purposes, we left these nice. We built them up so that they're up to the bite. And for now, we're gonna make them a lower partial denture. Eventually, he'll get implants on the lower as well. But once again, look at the amount of bone I left up there. And we were able to transplant a lot of bone up there. Beautiful, look at that. I mean, when he's ready for implants, that's gonna be happy times, okay? And the lower one's going to be a lower flexible denture for the time being, because what he'd like to do is he would like to get some crowns on his lower teeth. He'd like to get some crowns on his lower teeth, and then we'll match the color a little bit. Right now, he's currently bleaching. He's currently bleaching his teeth a little bit. You can see that they're not that far off. See? Let's go ahead and try in the upper denture. And by the way, it looks beautiful. It's gonna hurt him a little bit right there. Okay, close. Open. See that? Very nice, very nice. Okay. Okay, put your head back. So if you see this here, the teeth are not mounted, right? So what we're gonna do is we're gonna go ahead, and this is a good example, because sometimes you might get this back from the lab, you know, there might be a problem with the setup, you know, maybe the person that mounted it maybe didn't mount it in the manner that we took the bite, and that's fine. But we're gonna move his head back in front, right there, and watch this. Open. And what we're gonna do is we're gonna put some material here, okay? You guys getting this? Just like this. Okay, close. Right there. Stay just like that. And that gap that's existing right now, they will remount it to this bite. And once they remount it to this specific bite, then they can reset the teeth perfectly. So that's no problem, okay? What you can do too is when you're doing the try-in, you can actually take a picture with your phone or with an iPad, and you can put a line right down the middle of the face, okay? In this case, we can't show the patient's face, but what you can do is you can look right in between the eyes and center it off on your phone, and you can determine if the midline on the teeth is actually correct. So in this case, what we can do is you can see that it needs to be shifted over to the patient's left, maybe a couple millimeters, okay? So we had a gap there in between the teeth, so now we took some bite material. Open. There we go. We'll remove this upper denture. Like that. Okay. You see that gap? The teeth are touching back here, but they're not touching in the front. So all that needs to be, will be realigned, okay? We'll have them reset the teeth, and then we'll see you in a couple minutes. You got that?
This is lower triangle.
Lower triangle.
So the all.
Very nice. See? This is going to be a flexi for now. And then later on, when we try to figure out a fixed solution for this, maybe you could even possibly do a bridge and then maybe an implant on the lower right. So let's try this beautiful upper. See? Now remember, we talked about how he has a lot of bone, and that's a good thing. Right now we're trying to get him a nice upper denture for him to work with while we get him ready for. Okay. There's upper. Okay, close. There it is.
Nice.
Got that?
Yep, now we can check
Okay.
some bite to it.
¿Cómo lo ve?
Yeah, side of each group. Change the direction. Yeah. More. Yeah. Oh, it's good fitting.
Yeah, okay.
Oh no. Okay.
So look at that.
Underneath the other
See
side.
that? Beautiful. See that?
It's now
That's his
good.
bite. It's good.
Chin up, chin high.
Okay, see?
You make chin high. Yeah.
So one of the things that with him, ever since he was a child, he was always in a class 2, and he always had a gap. He had an open bite.
The other side.
Okay, but now
Yeah, better.
with his denture, we're able to fix that.
Yeah.
Right?
It's
Looks pretty.
beautiful now.
Looks good. I'm happy with it. I did tell him. We discussed about how he feels that this is bulky, but again, I reminded him it's a good problem to have, because we want bone so that when he has the implants, it's better to have bone than to go and find out that you don't have enough bone, right?
Stop. Okay. Right. Nice. Yes.
Because it's
And then a little
the
bit down.
lower that side.
Yeah.
I cannot go the
Yeah.
cannon and lateral mooring.
Yes. I'm okay with this. This is good. You know, we can possibly see what you can do on the left a little bit there. Bring the upper out just a little bit. See?
Which one?
Right there.
More out.
Just a little bit back here. Just to see what you can do, okay? Or maybe bring in 20, just a little bit. See? Just a little tiny bit right here, but so it's kind of balances out.
Oh, okay.
Okay? But other than that, I think him biting down, like the bite is good, everything is in contact. It's nice.
Now after polishing, we put the finals mineral oil, make the shines, dentures. So we can finish it both top and bottom. It's ready to go. There's another one's TCS. Alright, so now it's the top and bottoms. Change it. Dr. Emilio put this. We're going to cement it. Not cemented. We're going to polish it. And the lower. We set it. Now good. We're going to change the crown. Now check the occlusion contact.
Okay, right? Close. Close. Nice.
Good check. Good check. Size.
Nice.
Okay. Open. Right. Nice. How's it feeling?
Solamente acá empezó a lastimar un poquito.
So we can go
Okay.
a little bit.
Yeah.
Okay.
Acá y acá era.
Okay.
All right. So we're going to change the canine so just make sure the color is different. I know some people's thank you,
Yeah.
bite. Thank you. Beautiful job. Thanks a lot. Thanks for coming. Some people said E.
Y
Nice.
It's nice. This is perfect. This is gonna get him by. and he's gonna get some implants in the future, so this will get him through. This is what's important, something functional for now. But we wanna make sure he has a lot of bone, and that's a good thing to have.
Just make sure this is the wax try-in, so we're going to put some characteristics, and then we can processing, and then after processing, we try to make a little bit thin down, we change it here and there. That's the final will be.